Today, we're gonna talk about the clinical application of electrocardiogram ECG.
Introduction. So, what is ECG? ECG function is to diagnose all specific cardiac abnormalities. Electrocardiograph is the instrument for recording. Electrocardiogram is a record or display of a person's heart.
Purpose of ECG measurement. Firstly, to reflect underlying heart conditions. This means ECG assists in monitoring heart condition. Second, to diagnose irregular heart movements, which are controlled by a complex set of electrical impulses that direct the upper and the lower heart chamber to contract and relax rhythmically. Lastly, to identify when these electrical activities are interrupted and misguided. Arrhythmia can be the symptoms of the heart disease.
Human heart. Human heart consists of four main components. First, heart valve. Heart valve function to regulate the direction of blood flow. Second, heart muscle. Heart muscle gives structure to the entire heart and divides the heart into chambers: left atrium, right atrium, left ventricle, and right ventricle. Third, electrical system, which are systems that controls and synchronize movement of heart muscle. Fourth, coronary arteries, which are the artery that carries blood, nutrient, and oxygen to the heart tissue. There are two types of ECG lead system. First, standard 12-lead ECG, and second is basic lead ECG. So, what is the difference between these two types of ECG? For this type of ECG, it contains 10 electrodes, 6 electrodes on chest and 4 on the limbs. For basic lead ECG, it contains 6 leads: lead 1, lead 2, lead 3, AVR, AVL, and AVF, and only use 4 electrodes.
There were 3 types of leads, which are standard leads, augmented lead, and precordial leads. Standard leads consist of lead 1, lead 2, and lead 3. Augmented lead consists of augmented vector right (AVR), augmented vector left (AVL), and augmented vector foot (AVF). Meanwhile, for the precordial leads, it consists of V1 to V6. Now, we move to the electrode placement. V1, placed on the fourth intercostal space at the right sternal border. V2, placed on the fourth intercostal space at the left sternal border. V3 were placed on the halfway between leads V2 and V4, while V4 was placed at the fifth intercostal space in the mid-clavicular line. V5 placed on the left anterior axillary line on the same horizontal plane as V4. V6 were placed on the left mid-axillary line on the same horizontal plane as V4 and V5. For the right arm, were placed at the right arm on the inner wrist. For the left arm, was placed on the left arm on the inner wrist. For the right leg, it was placed in the right leg in the inner ankle. And for the last, the left leg were placed at the left leg on the inner ankle.
These are the procedures for ECG skin preparations. Firstly, shave or cut hair from electrode sides, since excessive hair prevents good electrode contact. Second, clean each side thoroughly with soap and water. A non-alcohol wipe of 4x4 to improve electrical flow. Next, dry the skin vigorously to increase capillary blood flow to the tissue. Lastly, lie flat while the computer creates a picture on a graph paper of the electrical impulse traveling through the heart.
Standard ECG waveform. ECG waveform was consist of PQRST waveform. For the P wave, which is the state where the arterial depolarizations occur. Meanwhile, QRS complex present the state when the ventricular depolarizations occur. For the T wave, it was the state when the ventricular depolarizations occur.
This is how to read ECG paper.
Clinical applications of Holter monitor. The Holter monitor is a type of portable electrocardiogram ECG. It records the electrical activities of the heart continuously over 24 hours or longer while you are away from the doctor's office. A standard or resting ECG is one of the simplest and fastest tests used to evaluate the heart. Electrodes, which are small plastic patches stick to the skin, are placed at a certain point on the chest and abdomen. After the test period, return the monitor to the technician. The technicians will process the record of the heart activities and prepare a report for the doctor. This will include the notes in the patient's diary. Patient should get the result of the test in 1 or 2 weeks. Why we use Holter monitor? We use Holter monitor when abnormal symptoms occur, such as dizziness, fainting, low blood pressure, prolonged fatigue, and palpitations. Wearing the monitor may tell the doctors the information of if a patient medicines are working, why patient have symptoms such as dizziness, faintness, or the feeling that patient's heart is racing or skipping a beat. If patient heart is getting enough oxygen to meet its needs. These are some of abnormalities of ECG waveform. Normal sinus rhythm, sinus bradycardia, sinus tachycardia, supraventricular tachycardia abnormal, arterial fibrillation, atrial flutter, first degree AV block, ventricular fibrillation abnormal.